Hello, everyone. This is the opportunity to look at the neuromuscular assignment description and scoring rubric. This is a signature assignment, meaning that it is an assignment that the expectation is that you all will really look at this case involving MK and take the information that you've learned about neuromuscular conditions, both in lab and in lecture, but especially in lecture, and apply it to a specific case. So I think it's very useful to look at the purpose of this assignment, which is to provide you an opportunity to apply your knowledge of the ICF model, which you've become familiar with, especially this term, and for you to develop a hypothetical treatment plan for this patient with a neuromuscular condition and in a simulated clinical situation. So essentially what you'll be doing a year from now in an actual treatment environment. And so the course outcomes that we're looking at specifically are being able to apply the Classification of Function and Disability International ICF model when describing body systems and their associated effects on the movement system. You are certainly familiar with health conditions and impairments, and then what impacts the health condition and impairments has on this individual's ability, for example, to participate and to socialize, among other things. And then to develop simulated PT sessions based on sound clinical reasoning, evidence provided in the case, and patient-client-centered approaches, specifically based on the PT plan of care, and then to select appropriate interventions to improve aerobic capacity, integument, motor function, which would mean movement, and possibly use of assistive devices, in this case in an adult. And this kind of dovetails nicely into core learning outcomes, as you'll see, especially in regards to taking a risk with possibilities that are within the PT plan of care, and also with working with others. So you are PTA working in a hospital setting, an acute setting, for a patient that was evaluated yesterday by the physical therapist. And so this clinical instructor, which in this case is me, is asking you to demonstrate your ability to interpret a plan of care and to develop a treatment plan with prioritized interventions that include family education and training and discharge planning. And it's also to assess your understanding of situations and conditions for future sessions, so we need input from the PT. So we're looking at our treatment for 3 sessions is what we're looking at. And so the table you're going to create as part 1 is the select interventions that you are choosing for this particular patient. That could be neuromuscular, re-education, it could be functional activities, which would include bed mobility and transfers. It could possibly include other interventions as well. I don't want to be giving away the farm here, but certainly you could look at therapeutic exercises as well. Again, I don't want to just tell you what to do, but these are some interventions that you may choose, and these are their associated billing codes attached to it, which we'll talk about in a minute. You have access to this slide within Moodle under PTA 103 under the category PT billing codes. So you really want to know how you're going to really simulate this or create this table. So you've picked your interventions, and I really want you to start out with picking ones that you would use for this patient. Not ones that you might use, but ones that you're really going to focus on. And I don't want you to split hairs so much on the exact amount of time you're going to spend. I think it's important that you consider time management, and if you're going to work, for example, on therapeutic exercises, that you explain, why you're going to be doing this. And that's what you're going to do in this connections to the ICF. Why did you pick therapeutic exercise as your top intervention? And then why did you pick therapeutic activities as your second intervention? And you need to justify that based on the ICF model. And how you might include a family member in the education or provision of each of these services. That is part of the connection to the ICF as well. Okay, and that's coming in part 2. But look at part 1. When you're picking these interventions, why are you picking them? Relate to the ICF model. What impairment does this patient have that would guide your decision to work on the select intervention? And you need to document too why you would want to communicate with the PT or why you need to. And we're not looking at hypertension and vital signs, O2 sats. That's not what I'm asking for in this assignment. I'm asking for things related to the neuromuscular system, the health condition of this patient. Now, certainly those other problems could happen. You could have unstable vital signs, but really in this situation, I'm looking for you to pick reasons based on what you know and what you've learned in terms of the neuromuscular health condition of a stroke, to what may change in that treatment session that would be a reason to contact the PT. And if you're really stuck, you certainly can go back to the first few weeks of the year, back to Pablo Rulo, and it talks about reasons you would communicate to the PT that can be applicable in the case of this patient with the health condition of having a stroke. And then you're going to put in your PT billing code within this table. So you're going to pick at least 4 interventions. And I'm not looking for day 1, day 2, day 3. No, I'm looking for specific interventions that you would use in the potentially 3 treatment sessions of an hour. Okay, so that's what you're going to be thinking about. That's what you're going to be thinking about. Part 2, and I jumped into it maybe a little fast here. Part 2 is separate from this. How would you involve a family member in education for this patient and provision of each of those interventions? What factors might influence the patient's ability to discharge home with home health services, outpatient, or to a skilled nursing facility? So this is where you're going to really look at, how is this patient doing cognitively? What is their gross motor function? How is that going to help determine what is the most appropriate placement? And certainly this is going to be based on your best guess on your patient response to treatment at the time in regards to the duration and intensity of the therapy interventions you provide. So that's going to help guide your decision. What is that patient's status hypothetically going to be after 3 sessions? Are they going to be in a place where they can go home and get home health services, or go home and come back as an outpatient, or continue more acute care physical therapy in the step-down skilled nursing facility versus a hospital? And then which 2 healthcare team members would you include in your discharge planning process, and why? Give examples of why you would select these 2 people to help guide your decision and include in your discharge planning process. You have links to the Barthel Index. Let me just share that with you real quickly here. Barthel Index of ADLs, the one that scale that's 0 to 20. So in this case, you're looking at the Barthel Index on a scale of 0 to 20, not based solely on 100. So if this patient scores a 7, what does that mean? What does that mean if that patient is only scoring a 7 out of 20 on a Barthel Index? Looking at these various categories and having some interpretation hypothetically of what that may look like in terms of this particular patient in this scenario. So that is going to help decide your discharge planning, among other things, as well as the response of the patient at the time to your physical therapy interventions. So you have the information of the case here, the test and measures that were used for this particular patient. The evaluation and prognosis, the goals set by the PT. Again, we're looking at, in your case, about 3 1-hour sessions, so 3 hours total. These goals are definitely optimistic, but in most hospital stays, you're really looking at about 3 days before the patient is discharged. This is due March 2nd, not the 4th. And so here's your interventions. This should help guide you as well in terms of what you select for your interventions. And here's the scoring rubric. You can see there's a real hefty amount on the interventions you choose. And then to exceed expectations, this is what you're going to do in your table. And secondly, 20 points is the connection to the ICF, strong connection of each intervention to one or more of the domains of the ICF, clearly connected to a specific situation and activity goals, in this case MK. And then you're providing credible reasons to consult with a physical therapist that are not vital sign related, in this case. And then finally, your discharge planning, identifying those other healthcare professionals and using the information such as the Barthel Index to guide your decision, and projecting what discharge placement MK will be at. Placement meaning the IC or the SNF, home health, or outpatient, and then selecting appropriate codes based on the amount of time you're spending with the patient. Again, not a scientific, it has to be 4 codes for 1 hour, but it needs to be in the ballpark. And then finally, this is college level writing, so we're expecting good formatting, easy to read paragraphs, and including your SPTA designation. So this is a hefty assignment. It is one that's going to take some time and a lot of polishing up. You certainly can work in a group, but I do not want to see copycat assignments submitted, meaning student 1's assignment looking like student 2's and student 2's looking like student 3's. Make it unique and individual, but certainly work together as groups to help get organized on this and run your rough drafts and run them past each other. Use the Can You Help Me forum as a way to get feedback from your classmates. And then lastly, if you exhausted those two and you really want to reach out to me, please do, but I recommend you do so in a timely fashion, not at the last minute, because the term will be getting really tight and really busy for all of us as we're getting into that first weekend in March. There's coming up a lot of activities within the program, and certainly with the OPTA too. But I will do my best to respond to you in a timely fashion to provide you guidance as needed. I look forward to your assignment submissions, and have a good evening.